Hi, my name is Samantha and I'm an IBCLC with SSM Health. I'm going to talk about breastfeeding today. Many mothers want to know why they should choose breastfeeding. Breastfeeding offers very good nutrition for baby. It helps mothers bond with their infants. It also reduces risk of serious illnesses for mothers and babies and is potentially cost effective for mothers versus formula feeding. The World Health Organization recommends breastfeeding for the first 6 months of life, followed by continued breastfeeding with supplemental feedings via table foods or whatever your pediatrician recommends, up to 24 months or as desired by mother and baby. The AAP also includes this as their recommendation. You should start considering breastfeeding in the early parts of pregnancy. There are evidence-based resources that you can look up online via the CDC or the AAP, as well as different public health departments or your healthcare provider's website. You can also reach out to a breastfeeding specialist to talk to them about any breastfeeding concerns that you may have. Breastfeeding supplies are not necessary for breastfeeding, but it's not a bad idea to consider adding these to your registry or reaching out to friends to see if they have any extras or just picking these up yourself to have handy for after you come home with baby. Double electric breast pump is ideal, but it's not necessary. So if you get a manual breast pump, that's fine, but you should consider portability, sizing, and different reviews on different breast pumps. Insurance sometimes covers these, so reach out to your hospital and your provider to see if they can help you with that. Other things like nipple creams, pumping bras, nursing bras, absolutely not necessary, but they can make breastfeeding a little bit more comfortable. Your body will go through two different phases of lactogenesis. The first phase is colostrum, or that early milk. You start to store that in your body in the early parts of pregnancy, and your baby will feed off of this for the first few days of life as your mature supply starts to come in. Lactogenesis 2 is that second part of breastfeeding. So this is when your baby and placenta have delivered, your milk will change into what's called mature milk over the course of a few days. So that colostrum in the beginning is what I like to call the whole milk of milk, or the liquid gold of milk. It's very nutrient dense. It is small quantities, but so full of calories. So it's exactly what baby needs to stay satisfied and full and grow. And your milk over 3 to 5 days will start to come into that transitional to mature milk, and that will stretch your baby's tummy so that they're eating the larger quantities of milk that they need to continue to grow. There are many myths to breastfeeding. A few listed here are that breast milk doesn't have enough vitamins compared to formula, that it'll make your breasts droop, that you won't be able to produce enough breast milk because your breasts aren't big enough, that breastfeeding will be very painful, or that you won't be able to make enough milk because your mother or sister or family member couldn't. All of these are simply myths. You should reach out to your local lactation consultant if you have any concerns about these, and they can help run through them with you and help you find out if breastfeeding is an option for you. Knowing if your baby's getting enough milk is a really big struggle for most moms. So here's a list of things that you can run through once your baby is born to make sure that your baby's getting enough milk and give you that satisfaction that things are going well. You should write down feedings in a 24-hour period and make sure that your baby's eating 8 to 12 times. The baby should be happy and content after feeding, so very calm, maybe sleeping and not looking around for a breast. Your baby will also gain weight if breastfeeding is going well, and your pediatrician will keep an eye on this. You'll have periods of audible gulping or swallowing during feeds. A lactation consultant or your nurse can help you listen for those and learn how to hear them properly. Your baby will have differences in their stool, and they'll have a certain number of wet diapers. And again, your nurse or your pediatrician will help you determine this. And you'll have breast changes. So your breast will be very firm in the beginning of the feeding, and then they'll return to soft at the end of the feeding. And that helps you know that milk was transferred. Taking care of yourself after baby is so important. You need to make sure that you're eating at least 3 meals per day. You should have a well-balanced diet. Some of those nutrients go right into the breast milk to feed your baby. And you should eat an additional at least 500 calories a day to ensure that you're nourishing yourself to make breast milk. You should also ask for help. So don't feel guilty about taking time to nap, let the chores go, even just have a messier house than you normally would. This is your time to bond with your baby. You should also join support groups if they're available to you. So reach out to your local hospital to find support groups. Here in Janesville, we have free classes for community members who will be delivering at our hospital, as well as breastfeeding support while you're here. We also have a lactation clinic that patients can come to after they go home from the hospital to ensure that all their breastfeeding questions are being answered. You should reach out to your local SSM Health to find the resources that you have if you're not local to Janesville. Additional breastfeeding resources are listed here. All of these are very good breastfeeding resources for moms if they need something to have an in-person consult, if they can go somewhere to see somebody, or even just Google something if you're looking for like an internet-based answer. So kellymom.com is good science-backed research, as well as womenshealth.gov. And then the other options, WIC, La Leche, and the local health departments can sometimes do in-person appointments either in your home or in their clinic. Thank you for listening to my talk today, and I hope you have a very successful breastfeeding journey.